Go to the patient record function of your ultrasound machine to begin a new patient record. Entering patient information in the patient record screen establishes a new patient file before the exam, allowing you to store current patient information such as owner name, pet name, age, weight, and reason for the ultrasound. The patient record file also allows you to save ultrasound images and measurements for the patient in the file. The patient record screen also encourages you to choose an exam option. In this case, the abdominal exam option will optimize the ultrasound machine's presets for an abdominal examination and place an index indicator on the left side of the ultrasound screen. In preparation for an abdominal ultrasound, ideally the patient should not be fed within 12 hours of the examination. Food and gas in the stomach will cause the stomach to enlarge and move cranially in the abdomen. This usually obstructs your view of the liver and gallbladder or any structures dorsal to the stomach. A diabetic patient is an exception and should be fed and receive insulin as usual. All patients should have access to water at all times. Realize that when instructed not to feed the patient, many pet owners will take away food and water. You do not want the patient to be dehydrated for the study, so clarify this point with the pet owner and your staff. The patient should not be walked to urinate just before the ultrasound. The urinary bladder needs to be full for your exam. Do not withhold medications on the day of the ultrasound. Any medications should be given as usual. I do not sedate most patients for an abdominal ultrasound. I will sedate if the patient is fractious, highly nervous and panting, or painful. It is best to shave hair from all areas where the ultrasound transducer will be in contact with the patient's body. The owner should be told this will be a lot of hair. The hair should grow back. With the patient in dorsal recumbency, start at the xiphoid and shave straight to the right and left sides. Do not follow the rib cage as you normally do for a stay. The head of the spleen is cranial to the last rib on the left lateral wall of the stomach. If you do not shave dorsally enough or cranially enough, you may miss lesions in the head of the spleen. The left kidney, left adrenal, and aorta are on the dorsal wall of the abdomen and usually caudal to the last rib. If you do not shave dorsally enough, you will have difficulty finding these structures from a left lateral sagittal position. In dogs, the right kidney, right adrenal, and caudate liver lobe are in the dorsal abdomen and cranial to the last rib. If you do not shave dorsally enough or cranially enough, you will have difficulty finding these structures. Prior to the exam, alcohol is used to wet the patient's skin and eliminate air bubbles. The areas to be imaged are then covered with ultrasound gel. If the gel begins to dry as the exam continues, use alcohol to rehydrate the gel. I prefer to perform abdominal ultrasound with the patient in dorsal recumbency on an abdominal ultrasound trough or cushion. The cushion is comfortable for the patient and has a shallow V trough to allow maneuvering of the transducer on the patient's lateral surfaces. Gravity causes the abdominal organs to settle into predictable locations in the dorsal recumbency position. In other positions, gravity causes the organs to sag caudally or ventrally, making it more difficult to get proper viewing positions. Some patients cannot or should not be placed in dorsal recumbency. Some animals are simply too large or will resist or struggle in a dorsal recumbency position. It may be necessary to do the exam in a lateral recumbency position. The positions of the transducer on the patient's body do not change. A dog or cat in respiratory distress should not be forced into dorsal recumbency. These patients may need to be studied in a standing or sternal recumbency position. Use of a cardiac exam table may make it easier to image the ventral abdomen in sternal recumbency. Gravity-dependent gallstones or urinary bladder stones can be rechecked in a standing position to see if they change location to confirm the presence of a stone. In a standing or sitting position, the liver moves caudally and may be more easily imaged in a large, narrow-chested dog.